Yeah, thank you so much, organizers, for giving me this opportunity. And thank you so much, Punita ma'am, for introducing me. So I am going to present the abstract of the Pathways Heart Study. As Dr. Punita has already mentioned, yes, we all are worried about this. Many breast cancer therapies routinely that we use that are cardiotoxic. And we also know overweight and obesity. They are also risk factors for cardiovascular disease. So the question arises, does the risk of cardiovascular disease varies by BMI in our patients, in our breast cancer patients? To address this question, this study was started, and the patients were chosen from KPNC, California region. And in this study, breast cancer patients who were diagnosed between 2005 to 2013, they were included in the study. And these patients received chemotherapy in the form of anthracycline, trastuzumab, taxane, cyclophosphamide. They also received endocrine therapy and also received radiation therapy, either right side, left side, either side. And the outcomes that were observed were ischemic disease, heart failure or cardiomyopathy, or stroke. And Cox proportional hazard model was used for statistical analysis, and the woman whose BMI was less were 13,582 with mean age of 60 years and with mean follow-up of 7 years. So coming over the results regarding heart disease, so the results were actually, I was very much surprised to see all these results. So for women with normal weight, so who were receiving anthracycline, they were at higher risk of developing ischemic, as you can minutes, only 2 minutes, because this study. So this the another important point that I want to show you, that incidental heart failure and cardiomyopathy for women with normal weight, they were more common with the patients who were receiving anthracycline, cyclophosphamide, or left-sided radiation therapy. But for obese women, there were not factors. There was no risk for obese women. This was very, that we think it's very different from what we think. And when we talk about stroke, so stroke was you can see in this forest graph, was less for the patient who were obese but who were receiving anthracycline, who were receiving taxanes or cyclophosphamide. And for when we talk about normal weight, for a normal weight women, the patients who were receiving taxane, cyclophosphamide, or left-sided radiation, they were having higher risk in comparison to the women who were not receiving these therapies. So to conclude, certain chemotherapy drugs and left-sided radiation may confer high risk for breast cancer survivors with normal weight. Yet, yes, what they have observed, certain drugs may lower stroke risk for breast cancer survivor patients with obesity. So this was actually different. I think it's a very difficult to say what about this. So they have concluded it may be due to obesity paradox that has been observed in other populations also. So when I talk about Indian perspective, so what I think, I have seen so many studies, but we should actually do from because Indian patients are different from these patients. We are having now more patients are having cardiovascular disease. So we should start these type of studies, and the results of this study is actually very different. So they what they do, they have analyzed, they have planned that they should examine what they should see what different doses and duration of other therapies across the BMI groups have contributed to these risks. Thank you so much.